Hello, class. My name is Thomas Lay. I am a son of a dentist and a hygienist. Originally, my parents wanted me to go into the dental field, but now that it is harder to find staffing in all medical jobs, they suggested going into a different medical field, and that is why I decided to choose pharmacy. So, some background information. Pharmacists mainly advise health professionals and patients on medicines. They also dispense drugs and medicines prescribed by physicians and other health professionals, as you can see by the pictures. So, physicists mainly work at hospitals and supermarkets. Uh, some examples of those would be CVS and Bel Air, which I have seen often. Job responsibilities. So I chose this career because I love working with medicine and I loved experimenting in chemistry class. I also did not want to deal with specifically caring for somebody physically, and I did not want to deal with blood. So, some typical work hours would be full time, part time, most nights, weekends, and holidays. But according to others, the range is around 8 to 12 hours daily and roughly 44 hours a week. So, some job responsibilities for a pharmacist would be to provide patient care activities such as immunizations and simple diagnostic tests. The also would be doing prescribing medication and creating medication profiles for their customers. They also advise the medical staff on the selection and side effects of drugs, along with the patients that come to obtain medication. So, five personality characteristics for success would be empathy, responsibility, achiever, harmony, and learner, according to a survey in Pharmacy Times Journal. A typical day educating a patient. A typical day would be educating a patient on what the drug can do to them if overdosage occurs. You can also inform them on how much to take medication wise per day or time. They also suggest to come back for more medication when the patient runs out of medication. So some required information. So education wise, they pharmacy in pharmacy you need to learn about mathematics and natural sciences such as chemistry and biology and physics, as well as courses in humanities and social sciences. You also need 3 or more years at a college or university before moving on to a pharmacy degree program. If more schooling is needed after those 3 or 4 years, then 1 or 2 year there would be 1 or 2 years for residency programs or fellowships, and a research project would be needed if you wanted to work in a hospital. So a research project would consist of anything pharmaceutical or medical, such as any kind of organs in the body, or about maybe management or how you would manage a office or when you're in a pharmaceutical place like CVS. So some degrees required are the doctorate of pharmacy degree, which is as you can see by the picture, and there's also the PhD degree. So, some recommended schools. The three schools would be the University of California in San Francisco, the University of North Carolina in Chapel Hill, and the University of Michigan in Ann Arbor, according to the US News. So, the cost of schooling, just like any other medical profession, ranges pretty high. It would be 65,000 to up to 200,000, as you could see by the demographic. It pretty much ranges per state and school. So, for some licenses and certifications, you would need to graduate from a college of pharmacy that is accredited by the ACPE and pass a series of examinations. You would also need to take certification boards, and there's a terrible quality version of what the license would look like. For additional training, you must also complete 30 hours of continuing education courses every 2 years to renew their license. And an organization that is purely for pharmacy would be the American Pharmaceutical Association, which was founded in 1852. And basically, it's there to inform people about what pharmacists do and is a way for pharmacists to come together and learn together. So, employment statistics, the starting salary would be around 60 to 70 per hour, which means that the average would be around $59. And it may go up or down due to the coronavirus since there is a lack or not a lack of people in the field. So for the demographics, in America total, there would be 325,480 pharmacists. And out of the 325,000, there is 34,100 in California. And as you can see by the demographic, 56.8% are female and 43.2% are male, which is a lot actually for the female side. So, career reflection. I never really knew that behind the counter there's more than just giving medication out with a smile. I never knew that the pharmacist could mix and match these medications in order to make something new that could help somebody else. And that is what I really love doing. I also never knew that pharmacists work in hospitals, mainly because I'm in a area that has supermarkets around me more often than hospitals. Now, the reason why I think that this job is likable is I get to work with people and I get to experiment with medication to make something that could change people's lives for the better. So, for pros and cons, there's a lot of flexibility of when you can work. You also do have holiday time, or you could take some time off, a lot more time than at least minimum wage is now, 3 days. Uh, they also have a pretty relatively clean workplace. There's no blood, organs, body parts, saliva, or any blood anywhere, just a lot of medication and drugs. There is also flexible shifts. For cons, there is long hours. I do like my beauty sleep, but money over sleep, it's pretty much better. Mentally, it also can be draining because when you make a prescription or you make a mistake in the prescription, a life can be at risk, and that is not something nice to feel, especially when you accidentally might have killed somebody. There is a lot of schooling too, but that's pretty much every medical job. And these are all the references, and that'll be it. Thank you for listening.